% had ever consulted a dentist. This reflected the gap between the awareness of dental care services and actual attendance for such services by the population. As the first inaugural lecturer from the Faculty of Dental Sciences of this university, and because some of the members of this audience may wonder how oral health contributes to human health, I will briefly describe the concepts of health, oral health, and my place as an oral and maxillofacial surgeon in contributing to oral health. All of us will agree that health is wealth, and that without health, human development is impossible. The World Health Organization defined health as a state of physical, social, and mental well-being, and not merely the absence of disease or infirmity. It has been argued that this definition neglects the spiritual and emotional aspects of human health. While some of us will assume that healthcare workers determine the health of people, the fact remains that social, cultural, commercial, environmental, genetic, and biological factors are more relevant. Nigeria faces the triple burden of communicable diseases, non-communicable diseases, and a sick health system. Therefore, improving human health at the population level depends more on tackling these determinants of health, most of which are outside the control of healthcare workers. However, health includes the provision of healthcare services complemented by these social, economic, and behavioral determinants. Over the years, people have different perspectives regarding dentistry and oral health. To some, it involves treatment of teeth, removal of bad natural teeth, or the person to visit when toothache makes sleeping difficult. While oral health is related to dental or tooth care, it remains perplexing to many that producing a dentist takes 6 years of university education. The long period of study is to produce a health professional who is not only trained to manage teeth and the associated structures of the head and neck region, but is also skilled to appreciate the relationship between the background of the patient, the features of ill health, and the oral conditions present. This training enables the dentist to see and treat patients with dental complaints rather than viewing the tooth as the patient. The mouth contains the teeth and associated structures. It is useful for chewing, swallowing, speaking, breathing, and contributes to facial aesthetics. By initiating digestion during chewing of food, it also contributes to nutrition. The dental surgeon is the lead expert in the field of oral health. According to the WHO, oral health is defined as the state of the mouth, teeth, and orofacial structures that enable individuals to perform essential functions such as eating, breathing, and speaking, and encompasses psychosocial dimensions such as self-confidence, well-being, and the ability to socialize and work without pain, discomfort, and embarrassment. The concept of oral health encompasses a range of diseases, conditions, and relationships. Worldwide, the oral health conditions with the highest public health relevance include dental caries, severe gum disease, complete tooth loss, oral cancer, orodontal trauma, canker moris, and the congenital malformations such as cleft lip and palate. While most of these conditions are preventable, they also share common bases with other non-communicable diseases of global concern. It is estimated that the main oral diseases and conditions in various forms affect close to 3.5 billion people worldwide, almost half of the global population. The various oral conditions combined have an estimated global prevalence of 45%, which is higher than the prevalence of any other non-communicable disease. was around the age of 6 years when I
visited my younger sister on admission in hospital. She had suffered death from a domestic accident. Sadly, she did not recover from the injuries and died. She was just 3 years old. The circumstances in my death made such remarkable impressions on her.
I frequently read newspapers and magazines. This helped me gain information. And I realized it had similarities to medicine. Hence, when filling the JAMB form, I applied to study dentistry. My decision was based on 3 factors. These were interest, capability, and marketability. This opportunity to deliver an inaugural lecture is a testament that my decision then was apt. As a dental undergraduate at the University of Benin, I once had great doubt as to whether I would graduate. In my preclinical prosthetic technique practical, my performance was so poor that the lecturer advised I change to another course. On getting to the hostel, I told my roommates of my predicament. They were unanimous that changing courses after passing the BDS Part 1 examinations were unheard of and likely not possible. They encouraged me to persevere, engage in more practical training, and bear out the challenging situation posed by the lecturer. Luckily, the lecturer handed over the rest of the practical classes to a friendlier, more likable teacher. Our class did not meet with this earlier lecturer again till I took the professional exams of the course. Even at that, I failed the practical examination and hence the course. I later took the receipt examination, student for that examination, and passed. As a fresh dental undergraduate, I undertook dental internship at the base hospital Yaba, now 68 Nigerian Army Reference Hospital, and the military hospital Ikoyi. While in the former,